So, you've scheduled your first psychiatry appointment, but now the day's drawing closer and you're getting anxious. If I'm seeing a psychiatrist, that must mean I'm really crazy. I don't even know what's going on with me, so how will I ever explain it to a doctor? They'll probably just try to load me up on medications. Maybe I'll just cancel. Welcome, friends, to Shrink Talk with Dr. Robert, hosted by me, Dr. Robert, a board-certified psychiatrist. And on this channel, I talk about all things mental health. And in today's video, I'll be discussing some of the common concerns that come up before your first psychiatry appointment and what to expect from that appointment. All right, so let's start off with that first one, right? That somehow means you're crazy or there's something really wrong with you if you even are seeing a psychiatrist. Well, as I'm sure you guys probably recognize, there's quite a bit of stigma around mental health in the first place. And seeing a psychiatrist, that can bring on even more stigma, and people oftentimes feel some shame or concern just about the fact that they have an upcoming appointment or have been recommended to see a psychiatrist. But if we suspend some of that stigma for a bit, what does it actually mean if you are seeing a psychiatrist? Actually, I would say it's a very good thing if you're seeing a psychiatrist, because that means you're taking your health, your mental health, into your hands, taking it seriously, and doing something to hopefully better yourself. And for that, my friends, I say kudos to you. But what are some of the common reasons someone might see a psychiatrist? So I would say probably the most common reason I see patients is because they've been referred by either their primary care doctor, who's been managing their medications for whatever mental health symptom might be going on, but they sense that maybe this patient needs to see a specialist in the field, kind of get more involved evaluation and more in-depth recommendations as to how to proceed. Another reason is your therapist might recommend you seeing a psychiatrist. Oftentimes this is if you've been seeing a therapist for a while and for whatever reason your therapist believes it'll be useful to maybe get a second opinion, a consultation, and a diagnosis from a psychiatrist, or that medications may further help your symptoms than therapy alone can. But also oftentimes people come to me, without a referral, without someone telling them to see me, just because they want to get assessed for something that they've suspected they may have had, or they've seen something online that tells them, you've been diagnosed with ADHD or OCD if you do this or that. Those online quizzes, I do get patients because they've taken those online and then they actually want to come in and see, is this true or not? What's going on? And then the next common hesitation a lot of people have is just kind of concern over how will I express in this first appointment exactly what's been going on, my life story, what's causing me distress right now, what I want to work on, so that can feel very overwhelming. Well, good news for you. Trying to figure out how to explain those things, that's not your job, that's our job. And we're very well trained in diagnostic assessments, so when a patient comes in, typically I always just kind of lay out how the appointments work, but then I invite them to share with me kind of what is it that's bringing them into the appointment now, because that's usually the focal point and the thing they want to address first. And then as I'm kind of hearing bits of what a person's been struggling with, that kind of clues me in on as to what to ask next and what to dive into further and kind of suss out more of certain symptom clusters or other things that you don't have to worry about. But another thing a psychiatrist should always do on that first appointment is not just listen about what's going on now, but also screen for other mental health conditions that could also be going on, but not seem as obvious to you. And then we also always go over family history, medication allergies, any prior treatment history, and other details like that, including things about your childhood and upbringing, because a social history, getting a context of who you are in the whole context of your upbringing, relationships and all of that is also very, very important. That kind of brings me to another sort of concern a lot of people have, and that's talking about their trauma to a stranger on the very first appointment. So take ease. Definitely don't have to get into details of your trauma on that first appointment. Absolutely not necessary. Oftentimes, if I do sense that there's some sensitive topic or trauma that person's experienced, I always let them know, there's no need to get into the details or anything like that, especially on the first appointment. And then the biggest concern I find that people have when it comes to a psychiatry appointment is the concern that they'll be loaded up on medication, started on meds without much explanation as to, what to expect from it, why they're being started on it, or anything like that. And I've definitely heard patient experiences where that has happened, sort of coming in for an appointment and being sent a prescription and not really having much of an understanding of what it's for, what to expect, but absolutely that's not how it should be. I think it's also useful to give patients time to think about it. Maybe you can discuss a few things, give some recommendations based off of what you heard, learned about them. Then you can meet up in a couple of weeks, have them think about those recommendations, look them up, and come back with questions and further discussion to actually set a plan in motion. Sometimes our recommendations don't even include medications. It might be just lifestyle changes, giving some guidance as to some stressors are going on in their life, or directing them towards a certain type of therapy that may be more useful than a medication or kind of work really well in conjunction with medication. Or sometimes even, psychiatrists, like I mentioned in the prior video, we do therapy, we have training in therapy. So sometimes we do take on cases to see weekly or every other week and provide therapy for those patients. Also throw in the caveat that every psychiatrist has their own style of how to go about that first intake. And there's nothing good or bad about most of them, but everybody's got their own take on it. And sometimes you vibe better with a certain psychiatrist than another. That's okay. You're always free to seek out another opinion if you don't feel heard or for whatever reason things didn't go well. And I think it's just useful to have a good relationship with your doctor and has sense that this is someone you can reach out to if issues or concerns do come up, that you can talk about any sort of hesitations pretty freely and any concerns that may arise in the future. All right, my friends, I hope that was somewhat useful to you guys. I hope that sort of alleviated maybe someone's hesitation about seeing a psychiatrist, or kind of give you an understanding of what you can expect, or maybe should expect. If you like this video, please like and subscribe so I can continue making these videos, talking about various mental health topics or addressing any concerns you guys may have, or any questions you have that you want a psychiatrist to answer. Definitely leave comments down below. And thank you so much for watching. I really appreciate it. And till next week, take care, my friends.